I think there's differences in terms of different surgeons in terms of where they like to have the incisions. In my experience, after the first 1,000, I have chosen to do higher incisions on the abdomen just because sometimes, well, a lot of my cases are more complex, and you need more of a focal length between your scope and your instruments to whatever you're operating on. So all of my incisions are typically higher than the belly button. They're all approximately 8 millimeters, which is kind of half the size of a thumbnail. Very rarely do I do more than 4 incisions. There's maybe 1 or 2% of cases I do a 5th incision. So on the day of surgery, typically the operating room will require you to be there a couple hours early. In that phase, it's a matter of just double checking the information, just making sure that all the T's are crossed, all the I's are dotted, so that in the operating room there's no surprises. They'll recheck your medical information, your laboratory workup. You'll meet with the nurse, typically the circulating nurse or the scrub nurse that will be assisting in your care. Anesthesia will come by and interview again, and they'll start an IV and give you some preoperative medicines. Prior to that, I'll have talked with you and gone over exactly what procedure we're going to do, and you'll sign a written consent to what that procedure is. And if you have any questions, we'll clarify what those questions are and make sure you have the answers to them prior to undergoing anesthesia.